Today, the field of phlebology is one of the most rapidly growing specialties, progressing at such a swift rate that vein clinics are emerging in nearly every municipality throughout the United States. Disconcertedly, there is no set criteria for actual quality of care being delivered. At Best Vein Care, our purpose is to establish a standard of excellence respected within vein clinics, a vision that can be achieved when practitioners come together with the allied intent of improving the quality of care delivered to each of their patients throughout the nation. Today, we are fortunate to have the ability to inspire this change, this elevation to bring physicians together from all across our great country. With an advisory board, we can help enact a level of quality care encompassing every aspect of patient care. From evaluating the patient to the procedure itself to even post-operative care for the first time, set a true criteria that will undoubtedly help to benefit each patient. With the establishment of BestVeinCare.com, we have now set a standard and thus a level of excellence that physicians can strive for, and at the same time, help patients make educated decisions when choosing the right vein specialist for them. Additionally, our site will give access to physicians looking to refer their patients to quality vein experts within any geographical area who are rated well and who perform vein procedures.
I think for patients to be able to mine a bunch of physicians to find the right one for them, right one meaning the one that's best trained, best suited to deliver the best quality of care to them from a vein standpoint, they need a resource like Best Vein Care.
Why Best Vein Care? The belief that all patients have the right to receive the highest quality of care for the treatment of venous disease is the cornerstone of Best Vein Care's foundation.
There really is no medium currently for a patient to, example, go on a website or go to the internet or go to call a society or anything to say, listen, I have varicose veins and I'm really trying to find the best doctor in my area. Some of the industry or companies will have listings of doctors in their area that use their product, but again, there's no credentialing process, there's no due diligence, and these doctors clearly do these procedures safely, and that's what's needed.
Although the benefits of Best Vein Care are multifaceted, first and foremost, it enables patients to make smart choices regarding their health care by selecting a Best Vein Care preferred provider or center of excellence. Because the training and experience of our providers have been validated and verified, a patient can be confident that the professional credentials are the platform for the delivery of excellent vein care. Best Vein Care Centers of Excellence have been granted recognition for their dedication to the highest standards established in the vein industry today and, as such, offer assurance of a positive patient experience. Ultimately, Best Vein Care is the link connecting patients to providers.
The idea of Best Vein Care is a terrific one because it really serves the needs of patients. Patients frequently ask us, can you give us a recommendation of a doctor that is knowledgeable and experienced in this field? And they want it for themselves or a family member or a friend. And by the frequency of how many requests we get like that, we just know how much demand there is from patients to really be able to separate out and make a determination of which doctors have that kind of experience and expertise. So anything that helps provide that to the patient and in a good, objective, and clear manner is really great for patients, great for the industry, and will ultimately be great for the doctors and business alike.
Best Vein Care is an avenue for vein specialists to provide the highest achievable level of care, which are reflected within the quality standards established by a peer-based advisory board. The establishment of a data bank of premier vein specialists will help us pursue the highest quality of care in the most efficient and economic manner. In addition, the data bank will empower Best Vein Care in such a way that, as an organized body, our strong position in patient result data will be used to communicate with third-party payers. The sharing of information through Best Vein Care's website presents an educational forum for physicians and their patients. From recognition of the top vein centers and top vein physicians to the best practices and advanced vein technology, there is an educational benefit for all. Best Vein Care is an excellent resource for reaching out to other providers in the medical community. The complimentary physician-to-physician link is an invaluable tool for educating referring physicians on the treatment of venous disease and an excellent venue for directing them to your practice. In the rapidly developing field of phlebology, a patient often seeks more information about their healthcare provider than simply where they are located and how to get there. Because of its validation and verification processes, Best Vein Care's distinct recognition differentiates you from all other vein care providers.
I think Best Vein Care is a remarkable tool for both physicians and patients alike to be able to access not only information about vein centers, but information about venous disease itself, so that they can log on to one site that will either tell them what they need to know about vein care or have links to organizations like the American College of Phlebology that can give them even more information that is vital in selecting a physician for their vein treatment.
Best Vein Care, a different formulary. As medical professionals, we embrace the traditions of the medical community, including the critical evaluation of our own performance. Accordingly, Best Vein Care brings credibility to the field of phlebology through identifying integrity and intent and measuring capabilities and results.
I think our thoughts and perceptions are reflected from our past experiences. And having been trained as a cardiovascular surgeon, we were so used to high standards of care, outcome-based medicine. And with the realization that most of the procedures in vein surgery today are being performed in vein centers within doctors' offices, there's no oversight, there's no standard of care, there's no level of excellence to aspire to. So the purpose of Best Vein Care was to establish levels of care, levels of excellence that would elevate the level of care of vein surgery or vein procedures within the United States being performed in doctors' offices.
Best Vein Care's regulatory framework is the foundation by which a vein specialist is verified and a vein center is evaluated. This framework or structural support is based upon rules and principles that mirror state and federal regulatory guidelines, such as the Joint Commission, Centers for Medicare and Medicaid, and the Accreditation Association for Ambulatory Health Care.
Vein procedures today are being performed both within the hospital as well as in a private practice setting. Now certainly some procedures need to be performed in the hospital, whether it involve a general anesthetic or x-ray equipment for angioplasty and stenting of vessels, but many of the procedures are being performed could easily be performed in the hospital. Now while there is oversight on those procedures within the hospital, there is no direct oversight on the procedures being performed in a doctor's office. Therefore we felt by establishing levels of care, levels of excellency within the physician's offices, we could raise the standard of care in the vein community today.
The Independent Advisory Board was intentionally selected and is composed of specialists from multidisciplinary training backgrounds practicing in varying locations throughout the United States. Although Best Vein Care is not a regulatory agency, it embraces the intent and the desired result of these regulatory guidelines. Through the collaborative efforts of the Advisory Board and based upon their collective knowledge and experience, vein-specific measurement criteria were incorporated into the general regulatory guidelines to establish quality standards for the delivery of vein care.
Best Vein Care is of critical importance to the patient. Today, when they go to the Yellow Pages or to a medical directory, they cannot differentiate the physicians. They all look the same. They only differ by their names and where they're located. Best Vein Care actually differentiates these physicians for them through the establishment of criteria to participate with us. We've set a standard of excellence through both quality of care, surgical outcomes, and it's based on the integrity and intent of the physician as well as our capabilities and results. There's no other form that patients have today that they can find out about their physician before they walk into their office.
As the benchmark for the future in quality vein care, The standards of excellence were developed to set performance measurements and to foster a culture of quality among best vein care participants. Meeting or exceeding these quality measurements determines your recognition as a Best Vein Care Center of Excellence.
Best Vein Care.
Best vein care.
Best vein care.
Best vein care.
Best vein care.